My name is Dr. Rick Munaretto. I'm an endodontist, and I've been a status clinical director for 11 years. My expert tip today is on handling cracked teeth. So the definition of a cracked tooth is really a tooth that has one or more longitudinal and incomplete cracks or fractures that start in the crown and they extend apically. And these cracks are typically on the mesial or distal marginal ridge, and a lot of times they're found under an amalgam restoration or a direct restoration that's being removed. They're typically found on maxillary molars, followed by mandibular molars, and then maxillary premolars. And as an endodontist, we see a lot of consultations for this. A lot of times the dentist is removing a restoration, they have a question, so they send it over to us. But I would say the majority of the time these teeth are asymptomatic, so they have a normal pulp, or maybe they have some cold pain or sensitivity, and they have reversible pulpitis. And the AE's position on that is that those teeth really only need cuspal coverage, full cuspal coverage. They do not require root canal therapy. Now, if those teeth develop any type of pulpal or periapical disease and they require root canal treatment, the best way to diagnose the extent of that crack and really see if that tooth is savable is to get it under a rubber dam, under the microscope. And under the microscope, we could actually use a combination of transillumination under the rubber dam, or we could stain the inside of the tooth and see where the crack goes. Now, a lot of people have an opinion on cracked teeth, but I think the pendulum since 2008 has come back more towards conservation of teeth. And if you look at the majority of the literature that's been published in the last 10 to 12 years, the success and survivability of these cracked teeth is greater than 80%. And in fact, this past July 2019, there was a study that was on the cover of the Journal of Endodontics by Dr. Matt Davis, and it was a great study put together. He basically took these cracked teeth, and they were pretty significant with radicular cracks, so meaning that the crack went not just subgingival, but it actually went into the canal up to 5 millimeters. And what he did was he had a very stringent protocol that he used, and he did the root canal treatment, but then he would steer the gutta percha below the level of the crack and use a resin-modified glass ionomer over the floor and in the canal, and then the patient was prompted to go get a restoration full coverage in a very short period of time. But he found that at 4 years, the survivability was 96%, and at 2 to 4 years, the success rate was actually over 90%. So I think that if you're interested in trying to save cracked teeth, it's great to use your local endo advisor in your club or local endodontist. Maybe have them evaluate that tooth prior to deeming that tooth to be extracted. I hope this helps. Thank you.